We are beginning with slide number 22 of the chapter 14 PowerPoint slides. Sometimes when we have an infection, we will also have lymphedema, which is blockage of the lymphatic vessels, which results in ineffective lymphatic drainage. But what happens is fluid accumulates within our lymphatic vessels and our around, especially in and around our lymph nodes, particularly the ones in our cervical, axillary, and inguinal regions. And that limb that's associated with those particular lymph nodes will become swollen and distended and often tender or painful to the touch, depending on how bad, the swelling is. All right, lymphocytes are 20 to 40% of all white blood cells, and the reason it varies is because you're going to have more when you do have an infection, or when your immune system is active, is more active. There are approximately 1 trillion lymphocytes in the body, and most are located within lymphoid organs and tissues. There are 3 classes of lymphocytes. I've only talked about T cells and B cells to you so far, but there are also lymphocytes called NK cells, which stands for natural killer cells. So T cells make up about 80% of circulating lymphocytes, meaning the lymphocytes that you find within the bloodstream. About 80% of those lymphocytes are T cells. B cells make up about 10 to 15% of circulating lymphocytes. And then NK cells make up about 5 to 10% of circulating lymphocytes. So a little bit of information about the T cells, and T stands for thymus dependent. That means that even though they're produced in the red bone marrow, they are transported to the thymus to mature and differentiate into the different types of T cells. So cytotoxic T cells directly attack foreign cells or virus-infected cells. So they provide us with cell-mediated or cellular immunity. Helper T cells stimulate other T and B cells as well as suppressing those cells. So helper T cells are really the first step in the adaptive immune response. They're the first step. They have to recognize the particular foreign substance or foreign threat, and they're going to activate the rest of the T cells and B cells. So helper T cells are like the without helper T cells, your immune system basically shuts down. So helper T cells are the first the first step in the immune response. Regulatory T cells will moderate the immune response because you do not want your immune system to be overactive. You want it to respond to the threat, but you don't want your cells of your immune system to keep on dividing and keep on producing chemicals and leading to the inflammatory response and all the redness and heat and swelling and pain that comes with that. So you want it to be effective, but then you kind of want it to stop whenever it's done its job. Memory T cells carry the memory of the agent that induced the immune response, so they can divide very fast if that particular threat comes back a second time. B cells, B stands for bone marrow derived cells. So just like T cells, they are produced in the bone marrow, but they also mature in the bone marrow. When stimulated by a specific antigen, an antigen is just a substance on a pathogen that triggers an immune response. So when stimulated by a specific antigen, B cells differentiate into plasma cells, and it is plasma cells that actually secrete antibodies. Another name for antibodies are immunoglobulins. You probably heard of antibodies, and antibodies help to fight antigens. Antibodies attack antigens. You can learn that. That'll help you remember the relationship between those two. So it's the antigen that is the threat, and it's antibodies that attack antigens. But we also call them immunoglobulins, and they're responsible for not cell-mediated immunity, but antibody-mediated immunity, which is also known as humoral immunity. Again, antibodies bind to specific targets called antigens. So you can just learn antibodies attack antigens. Natural killer cells, or NK cells, are lymphocytes that they are not part of the adaptive or specific immune response. They provide innate or non-specific immunity. They will attack foreign cells, normal cells infected with viruses, and cells that are cancerous. So they're continually in the bloodstream monitoring our tissues. We call that immunological surveillance. Immunological surveillance. So that's the role of NK cells. They do attack, and destroy, but it's not to anything specific. It's just anything they recognize as foreign. Now, the production of lymphocytes is called lymphocytopoiesis. So it's a long word. If you remember, red blood cell production is called erythropoiesis. So this is lymphocytopoiesis. And basically for your stem cells called, hemocytoblasts produce stem cells, and one group of stem cells remains in the red bone marrow and generates B cells and NK cells, and then the other group migrates to the thymus and leads to division of the T cells. So, and here you've got red bone marrow, you've got the stem cells called hemocytoblast, and they either produce lymphoid stem cells, which remain in the bone marrow. They're called NK cells and B cells, or the stem cells for T cells, which migrate to the thymus. And then down here at the bottom is just letting you know that NK cells function in immune surveillance or immunological surveillance. They are part of the innate or non-specific defense. And then the B cells function in antibody-mediated or humoral immunity, and the T cells function in cell-mediated immunity. Lymphoid tissues are densely packed lymphocytes in loose connective tissues. The tissue oftentimes is reticular tissue. Lymphoid tissues protect the epithelia in body systems, in other words, like the skin, the linings that are open to the environment, your oral cavity, your nasal cavity, the anus, vagina, urethra. So the collections of lymphoid tissues are referred to as MALT, or mucosa-associated lymphoid tissue, because these areas are lined with mucus, protected by a layer of mucus. The MALT is extremely important in the digestive tract. Examples of MALT are tonsils, appendix, Peyer's patches, and the Peyer's patches are located in the wall of the small intestine. So the location of the tonsils, the pharyngeal tonsils are also known as the adenoids, and they're located here in the nasopharynx. And then you have the palatine tonsils and the lingual tonsils. Lingual tonsils are associated with the tongue, and the palatine tonsils are in the back of the throat. And so they're a type of MALT. Lymphoid organs, they're called organs rather than tissues because they're separated from the surrounding body tissue by a fibrous connective tissue capsule. So lymph nodes, thymus, spleen, these all count as lymphoid organs. Lymph nodes So for the lymph nodes, just make sure that you know the greatest number of lymph nodes. They're concentrated in the neck or cervical region, the armpits or axillary region, and then the groin or inguinal region. They're called cervical lymph nodes, axillary lymph nodes, and inguinal lymph nodes. And here is the structure of a lymph node. Okay, so lymph does enter into the lymph node through these afferent vessels. Okay, so there's several of them. You can see how lymph enters through the afferent vessels, and it's kind of like a kidney in the fact that it has an outer layer called a cortex and then an inner medulla. So the lymphatic fluid or lymph is going to enter through these afferent vessels, through the cortex into the medulla. The cortex and this whole part here, hopefully you can see what I'm referring to. This whole level here is the cortex, and then the medulla is in this center area. So the cortex contains a concentration of B cells. The medulla contains concentrations of B cells and macrophages. Then you have, in the cortex, you have in the center of this like group of B cells, you have germinal centers, which contain B cells, and then also B cells that have differentiated into plasma cells. Let's see, the outside of the lymph node is just called the capsule. You find T cells in the paracortex, which is kind of in between the cortex and the medulla. And then the subcapsular space contains macrophages and dendritic cells. We will learn about this, but they're going to be able to take the antigen, engulf it, and present it on their surface, and so they can become antigen-presenting cells, or APCs. So when we talk about antigen-presenting cells, these are macrophages and dendritic cells, and they are found in a lymph node. They're found within the subcapsular space. Then I said the fluid comes in through the afferent vessels. It leaves the lymph node through the efferent vessel, and then there's just one of those. And then it will enter the lymphatic vessels, and finally end up in the thoracic duct or the right lymphatic duct. So that's how lymph nodes work. The thymus is the site of T cell production and maturation. Now, the stem cells for T cells are produced in the red bone marrow, but then those T cells, stem cells, migrate or are transported to the thymus. Here's the thymus, where they mature, and they also divide even more. The thymus develops to its maximum size during puberty, and then it starts to decrease in size. So as you get older, it actually atrophies or decreases in size. The spleen functions in filtering blood instead of lymph. So the lymph nodes filter lymph, and the spleen filters blood. And what it does, it removes the abnormal blood cells, and the old ones that are worn out need to be recycled. And it also initiates the stimulation of B and T lymphocytes and stores iron from recycled red blood cells. Now, in the spleen, and here's the spleen in a kind of a cross section through the abdominal cavity or transverse section. You can see the liver and the stomach, and the spleen is attached to the stomach, kind of lateral to the pancreas. But the areas of the spleen called red pulp contain large numbers of red blood cells, and white pulp resemble lymphoid nodules. So they're going to contain larger numbers of lymphocytes, etc. Checkpoint question 4. How would blockage of the thoracic duct affect the flow of lymph? Well, the thoracic duct, let's go back to that picture. The thoracic duct actually drains lymph from this whole dark green region, so the entire lower body and the left side of the upper body. So it is going to affect the flow of lymph in that entire region. And the next question, number 6, why do lymph nodes enlarge during some infections? And well, they're going to be producing larger numbers of lymphocytes for one thing to fight the infection, and they also will fill with a greater amount of lymphatic or a greater amount of lymph or lymphatic fluid.